We are in our front parking lot and we are inside a giant colon. This is Nolan the Colon. I want to give you a statistic. Studies show 1 in 20 Arizonans will be diagnosed with colorectal disease. That is a lot of people, and I'm so excited to be joined by Terry Bach. She is with the Arizona chapter of the Colon Cancer Alliance. So great to see you. You brought along a rather large rascal. This is Nolan, and there's actually a little class going on behind us. Tell us what Nolan does.
What Nolan does is he's a great little educational tool. He's a nice visual. You can see the polyps, and that's what's so important about colon cancer. And today, talking about screening of people, this is how you can prevent the cancer before it ever even becomes cancer.
And we said at the top of the show, March is National Colorectal Cancer Awareness Month, and today is Dress in Blue Day. When should we start getting our screenings?
We should begin at age 50 unless there's some other considerations, such as if you have an immediate family member who's diagnosed with colon or rectal cancer. At that point, you would want to get your scope done at least 10 years prior to the date of their age of diagnosis. So, for instance, I was diagnosed at stage 4 at age 45. My son will now need to be scoped at age 35, unless, of course, he starts receiving any type of symptoms or indications he may have a disease, and then he would need to be scoped immediately.
When we came out here, folks were really kind of in awe that Nolan is truly the inside of our colon, and it shows a normal colon versus one that is not normal. How important is it that we don't ignore those signs, that we get in and get screened, and that we talk about this, because this is a disease that we just don't hear enough about?
It's so important. This is the #2 cancer killer, and I think people are unaware of that. You hear a lot about breast cancer and prostate cancer, lung cancer, of course, being the #1, but if we eliminated smoking, this would become the #1 cancer, and more importantly, it's the one that we can actually prevent.
And there's a big symposium coming up. In addition to Nolan the Colon kind of going around the valley, and kind of a fun side of this, there is a symposium coming up where people can sit and talk to medical experts about this, right? Tell us about that.
Yeah, we're going to have a symposium at the Courtyard Marriott in Scottsdale, Salt River. That'll be from 7:30 to 12:30. We'll begin with a small continental breakfast. Seating is free, but it is limited, so we encourage people to please RSVP. We'll have all kinds of specialists and oncologists and dietitians and folks that can talk about this disease from the time of diagnosis through treatment and then what happens afterwards. Because in my case, for instance, I've become a chronic medical manager of a cancerous condition. So it's not just something you go, you attack, you beat, and you go on. Sometimes you have to continue a survivorship role.
And Terry, you're a beautiful face of beating this disease and being an advocate and making sure your children also do what they need to do, and it starts right here. Perhaps Nolan the Colon, it's a big rascal, but you may want to walk through it and get a first-hand look of exactly what you need to be looking for. Thank you so much. We appreciate you being with us. And I want to tell you more about that symposium that Terry told us about, the Colorectal Cancer Patient Survivorship Symposium, Saturday, March 22nd from 7:30 to 12:30. At Courtyard Marriott, Scottsdale, Salt River. Registration is required. It is a free event, but you do need to register. To RSVP, please contact 602-359-5995 or email them at centralazcca@gmail.com.